common cold. Treat the cold and it will end in 7 days, do nothing and it will last a week, old adage. On February 27, 1969, the Apollo crew showed classic symptoms: stuffed up noses, sore throats and cold-related fatigue. NASA postponed the launch at an estimated cost of $500,000, first time in 19 manned flights that astronauts' illness caused a liftoff to be delayed. The common cold is, as the name suggests, the most common disease caused by an infection in the world. The common cold causes the familiar symptoms of sneezing and runny nose. Both are manifestations of the body's immune response to the virus. There is an incubation period of 1 to 4 days. Symptoms usually start in the pharynx and rapidly progresses in the next 48 hours. The symptoms are due to inflammation and swelling of the nasal mucosa. The symptoms usually last for 2 to 4 days unless complications develop. Complications include watery nasal discharge, sneezing, blockage in the nasal passage, watery eyes, sore throat and congested sinuses. Occasionally fever may occur, purulent nasal discharge may take place at later stage. Colds usually involve infection in the upper respiratory tract. Most colds are not complicated and self-limiting. They resolve spontaneously. Complicated ones may be due to secondary bacterial infections and lead to sinusitis, otitis media, middle ear infection, and infections of the lower respiratory tract. Cold is not a single disease that strikes over and over again but are as many as 200 separate lookalike diseases caused by 200 different viruses. They all belong to 8 different groups but share one insidious trait, an affinity to human respiratory tract. Coryza and febrile colds, cold with fever, may be caused by one of the large group of viruses. 1. Rhinovirus, named from the Greek for nose, where its effects are felt. Rhinoviruses spread by direct contact. 2. Coronavirus, the second largest cause of colds. Coronaviruses were discovered in 1965 and spread in airborne droplets from coughs and sneezes. 3. Adenovirus. 4. Parainfluenza. 5. Echovirus. 6. Respiratory syncytial virus. 7. Coxsackie A and 8. Influenza A and B. You do catch most of the cold you suffer with your hands. By touching the virus-laden mucus on the surface and then rubbing it on your own nose or eyes, you deliver cold to the site in your body where it begins. Physicians define cold as an acute, fast-developing, viral infection characterized by the following. 1. Nasal congestion, stuffiness. 2. Edema, swelling. 3. Discharge, runny nose, and 4. Throat irritation, sore throat. Physicians call it as acute coryza, from the Greek coryza, meaning nasal mucus. Immunity following a cold is short-lived. As the viruses do not normally enter the bloodstream, there is no common antigen against which the body can build up an immune response. The symptoms of cold are the same for everyone, young and old, male and female, in all parts of the world. Infants and cold. Infants are the most cold-ridden group, averaging more than 6 colds and similar respiratory illnesses in the first 12 months of life. Women in their 20s and 30s experience more respiratory diseases than men of the same age. Mothers usually have closer contact with their children than fathers do, and that could be the reason. Unlike a bacterium, a virus has no mechanism for movement, no internal method of reproduction. It has no equipment for ingesting or digesting food and, in short, none of the abilities to consider in the world of living. A virus cannot even qualify as a cell. It is an assemblage of various chemicals to enable more new structures exactly like the virus to be produced, all surrounded by a protective shell. A virus cannot even cause such duplication on its own. Only when the virus gets into living tissue can it multiply. Then it takes over the host, using the living cell's own substance to produce more virus particles. The virus is very fussy about its unwilling host. For each kind of virus there is only one general kind of cell that the virus can subject to its rule. The rabies virus is a considerable threat to life as it takes hold in brain tissue. The poliovirus sometimes lodges in the spinal cord and brainstem. Some other viruses selectively infect the skin, glands or gastrointestinal tract, causing warts, mumps or a form of diarrhea. Cold viruses on the other hand attach themselves to the cells of the mucous membrane of the respiratory tract. The cells of the upper respiratory tract can be attacked by some 200 different cold viruses. Identifying the one causing a particular cold is painstaking, expensive process. But the ability to distinguish one cold virus to another is basic to the search for methods of prevention of cold. How the body fights a cold infection. The virus is spread as droplets. It enters the lining of the throat and nose, where it replicates. White blood cells are carried by the blood vessels to the site where they cause swelling and secretion of fluid, runny nose. The immune system has different strategies to deal with an infection. 1. It produces antibodies to neutralize the virus. 2. Other type of white blood cells recognizes and destroys the infected cells. 3. Phagocytes, another type of white blood cells, are able to engulf and destroy both virus bound to antibodies and infected cells. The symptoms of cold soon die down. The common cold is a mild illness causing discomfort for 2 to 6 days. It is likely to last longer only if secondary infection occurs. The symptoms like sore throat, cough, usually resolve spontaneously. Children who suffer 6 or more infections annually are more likely to suffer secondary infections like middle ear infection. Colds generally resolve with no specific therapy. Antibiotics are only suitable for secondary infections and should not be prescribed prophylactically, as a preventive measure. Cold or flu? How do you know if you have flu or cold symptoms? Take your temperature, say many experts. Flu symptoms often mimic cold symptoms with nasal congestion, cough, aches, and malaise. But a common cold rarely has symptoms of fever above 101 degrees. With flu symptoms, you will probably have a fever initially with the flu virus and you will feel miserable. Body and muscle aches are also more common with the flu. Is kissing a sure way to spread a cold? No. Colds are rather difficult to catch by way of mouth. Can you catch a cold from cold air? This is one of the most persistent myths about colds. The only way you get sick is when you come into contact with the virus. Should I get an antibiotic? Antibiotics fight bacteria, but that won't help your cold, which is caused by a virus. But your doctor may prescribe an antibiotic if you have some complications. For instance, if your sinuses are blocked and can't drain properly, you can get inflammation and a bacterial infection. Could my cold symptoms actually be allergies? It's possible, if you're sniffling but not achy or feverish. Also, if your symptoms last longer than 2 weeks, and you also have red, itchy eyes, it might be allergies. But it's often hard to tell the difference because people with allergies and asthma are more likely to get colds. They may already have inflamed and irritated lungs, so they're less able to fight off a virus. What are treatments for the common cold? Since there is no cure for the common cold, treatment has 2 goals, to make you feel better and to help you fight off the virus. There is no specific antibiotic that works against common cold virus. General measures include analgesics, pain relievers, steam inhalation for blocked nose and hot drinks to soothe the cough. Patients should refrain from smoking and avoid irritating fumes. Lots of rest is the key treating a cold. You may find you need 12 hours of sleep each night, so don't set that alarm. You'll be most comfortable in a warm, humid environment. It's also important to stay hydrated by drinking lots of water and avoiding alcohol and caffeine. This makes mucus flow more freely and helps with congestion. For aches and pains accompanied by a fever of 100.5 degrees or higher, give acetaminophen, Tylenol, rather than aspirin or naproxen. If your throat is sore, gargle as often as you like with warm salt water, ½ teaspoon salt in 1 cup water. Think twice before using heavily advertised over-the-counter cold and flu medications. Over-the-counter drugs. They are likely to contain drugs for symptoms you don't have and therefore may result in needless overtreatment. Antihistamines seem to help some people, but their effect during colds remains controversial. Good nutrition is essential for resisting and recovering from a cold. Eat a balanced diet. Take supplements as needed to ensure you are receiving the recommended dietary allowances. Especially for vitamin A, the vitamin B complex, vitamins B1, B2, B5, B6, folic acid, and vitamin C, as well as the minerals zinc and copper. Both vitamin C and zinc are essential for production of infection-fighting neutrophils. If you are without adequate levels of them, you're an easy mark for infections. After much research, vitamin C is believed to have a small effect in preventing colds, and no benefit in treating a cold. Chicken soup has been heralded as a cold therapy since the 12th century. Recent scientific evidence shows mild support for the notion that chicken soup reduces cold symptoms, especially congestion. Asian healing treatments often use hot soups to treat upper respiratory infections, making use of red pepper, lemongrass, and ginger, in particular. Any food spicy enough to make your eyes water will have the same effect on your nose, promoting drainage. Try rubbing diluted eucalyptus oil on the chest as a decongestant, or inhale eucalyptus or peppermint oil to clear stuffiness. Adding lavender, cedar, or lemon to steam may also soothe nasal passages. Inhaling menthol not only provides relief from nasal congestion, but might help inhibit infection as well. Rosemary, thyme, mint, basil, and tea tree oils can also provide relief from symptoms of a cold. Use caution if you have asthma, since aromatherapy can trigger an attack. Some research supports the use of the Chinese herbal remedies Yinjiao and Ganmaling. Echinacea may help strengthen the immune system by stimulating the activity of white blood cells, but there is little evidence that it can prevent colds in particular. Several studies show adults using echinacea at the first sign of a cold suffered shorter and less severe illness. If you decide to try echinacea, take small doses for no more than 8 weeks, since prolonged use may suppress your immune system. Little research exists to support the use of other herbs, such as astragalus, eyebright, elderflower, garlic, ginseng, golden seal, or yarrow. Human beings and cold viruses are made for each other. Without the presence of humanity, cold viruses would have disappeared long ago. No other creature in nature, with the occasional exception of the chimpanzee, can give aid and comfort to these viruses. Most cold viruses are transmitted by personal contact with a virus shedder or with a shedder's immediate environment. Contact includes a form of touching, handshaking, handling of objects like handkerchiefs, pens, telephones, drinking glasses or doorknobs contaminated. Therefore colds are common and it is difficult to avoid getting infected. Cold accounts for a large number of working days lost on account of illness. In an average lifetime of 75 years, a person suffers from more than 200 bouts of common cold, each lasting for 2 to 6 days. Yet a considerable amount of research worldwide has failed to provide a satisfactory means of preventing or minimizing the severity of cold illness.